Hey, good morning, everybody, and welcome to Great Day Houston. It is Medical Monday, and our doctors here. We're all having a little conversation. But we want to start off with something that's making some headlines. What if there was a magic pill that could diagnose cancer or any other ailment in your body? It may be possible in the near future. It's time to find out in Hot Topics. All right, on the panel this morning, we have former ER doctor and anti-aging specialist Dr. Richard Laconi, family and cosmetic dentist Dr. Terry Alani, bariatric surgeon Dr. Clifton Thomas, orthopedic surgeon Dr. William Hadnot, and orthopedic surgeon Dr. Brian Parsley. Good morning.
Good morning.
All right, I said former, but once you're trained in emergency medicine, you're always,
They always call you.
Yeah, because I've called you before. Okay, let's talk about this idea that there's a pill that could detect cancer. It's Google's in the early stages of developing it, and the pill would detect cancer and other illnesses in the body long before symptoms appear by traveling through the bloodstream and searching for malignant cells. Sounds like science fiction, but wow, wouldn't that be an interesting thing to have?
Yeah, and I think it still is science fiction for now. But I think they're pairing concepts that are known technologies, monoclonal antibodies. These are things that can they can design these antibodies to attach to anything, to identify anything. Then they're going to pair them with these little nanoparticles that they can then get the message back and forth. Pretty radical idea. And, they're just kind of trying to invent the next great blockbuster idea to keep their company going.
Well, as we always say, the earlier you detect most things, the better chances of getting rid of it and being well.
Well, I applaud them because it's all about prevention. So they're trying to prevent cancer instead of having to decide how to treat it once it's been diagnosed. But the thing is especially it's on your iPhone, and then you get alerted, and as a patient, I think that would make me very nervous because then it's given to your doctor. And I don't know if I would like that.
Yeah.
Well, it's interesting about technology because one thing often leads to another, which leads to another, and we are on a new phase in medicine.
All right, so let's move on to our next thing. This is good for our orthopedic surgeons. Drinking lots of milk may increase the risk of fractures and overall mortality. Now, we were told growing up, drink your milk, drink more milk because that's good for your bones. So what's the connection here?
It actually still is. I mean, drinking your milk is key to your overall health. Anything in excess, though, can be a problem. And this is one study that was done in Europe that demonstrated that people that had an excessive intake of milk actually had an increase in fracture rate. And a lot of that is just due to the enzymes within milk that actually changed the way your body absorbed the calcium and then had a negative effect. But calcium's really critical to your long-term benefit.
Right, and we're not getting
health.
it in a lot of other things. The way we eat today, we're missing out on calcium and a lot of other things, and vitamin D for that matter.
So a lot of times we need to supplement just to make sure that we get the appropriate amount so that we can continue to grow and keep our bones strong.
Yeah. Okay.
And there is a problem with studies. Just because something has a correlation doesn't mean that it causes it.
Right.
And if you look at the actual details of that study, the difference is so small. But it's an interesting piece of news, and so everybody is hyper in this age of technology and information, disbursement. Unfortunately, everybody's caught on this and say this is a reason not to drink milk, and it would be actually a disaster for people growing up.
Wow. And one of the other things is, isn't vitamin D added to milk?
Absolutely.
Yeah.
So that's just a way for us to get a source of vitamin D.
Isn't it better to do like non-fat or low-fat because milk actually has a lot of sugar in it?
Like I tell patients all the time, what's the calcium content of low-fat milk versus regular whole milk? Exactly the same. You just get rid of the fat and other things.
Yeah, and do we need to be getting rid of all the fat? I just got to ask this question. We've like gone fat crazy. We made fat the most evil thing. And so certain fats, especially if they're natural, aren't they okay for us? Aren't they important for brain development, things like that?
I think so,
To a degree,
yes.
absolutely.
Yeah, it's a balance.
And it still means milk products are still healthy because they take
I
some
eat
of the
my
lactose
ice cream. I'm telling you
and
right now, I'm
fat
going to
out.
have my ice cream.
I'm a big
Cheeses and
fan of
things.
goat milk, which is a little different than dairy.
Everything in excess is a problem.
Yeah.
So you have to just take everything in moderation.
Okay, speaking of taking some of these studies with a grain of salt, is exercise bad for your teeth? Now, see, that's the reason why I don't run those marathons and things like that, because I knew about this before.
That is one of the worst studies I've ever read. Exactly what he was saying. Everything in moderation. What they did is they took a group of athletes from the Olympics, I think in 2012, and it was really interesting. They're from all different areas of the world, and they said, oh, well, they had access to dental care, but a lot of them hadn't been to the dentist. Hello? Of course you're going to have more cavities. But what the study was saying was that these were endurance athletes. So they were recommending to drink more water. They said there was no correlation between sports drinks and cavities, which is totally ridiculous. There is a correlation, but it had to do with the alkalinity of the saliva in these endurance athletes, that it was more alkaline, so it caused more tartar buildup. Well, if you're going to your dentist twice a year and you brush and floss, you're not going to have an issue. So I say that study is ridiculous.
Yeah, and you should not use endurance athletes as your. They're not indicative of the rest of us. They've used that study before to say, oh, maybe you shouldn't run because, well, if you're running and you're stressing your body, again, back to the moderation thing. If you're stressing your body, then you may have more orthopedic problems.
Well, I'd be grinding my teeth if I was running a marathon anyway.
Yeah,
so
right.
probably is detrimental to
right.
my
You
overall
can get
teeth.
a night guard.
And she has one for you.
Exactly.
All right. This other study says that gastric bypass surgery leads to more weight loss. We know that, but also more complications. And when you say that word bypass weight loss surgery, that's a big word because it depends on what you're having done.
Right.
And again, it just proves that it's not the 100% answer. You still have to adjust your diet and learn how to eat well as well.
Exactly. So you're right. Bypass is the word. And that means we reroute and do quite a few things. And the way surgery works, the more complex an operation is, the more complications there is. And also, surgery is about risk and benefit. So if you have an operation that has some significant risk associated with it, you can only really do it on the people with a lot of benefit. They also tend to be the sickest part of the population.
Yeah.
So clearly you're going to have more complications. But it's also a much better tool than the lap band to help people lose
For a
weight
lot of
and
people,
keep off
it means it's
long
going to
term.
save their life. Yeah, so you have bypass, you have the sleeve, you have lap band. So there's different methods that we'll talk about a little bit later in your segment as
Cortex
well.
diabetes, things like that. It's pretty amazing what.
Absolutely. I was going to say that. Dr. Thomas is not some of the work he does in doing the gastric bypass work is really the key is for arthroplasty surgeons is that diabetes is one of the fastest growing diagnoses in healthcare, and it is a major detrimental effect on patients.
Number one reason for heart disease,
Absolutely.
amputations, blindness.
And if your diabetes is out of control, you have a tenfold increase in infection rate in any type of surgical procedure. So there's some good solid studies that show that if you have some type of lap band or a gastric bypass, that you actually have a control of your diabetes, which opens up
Save your life and
avenues.
quality of life.
Absolutely.
Well, thank you all.